deception. Open your eyes.
You can't handle the truth.
Pills on the table, scripts in their hand, money for the making, any way they can. Decades in the trenches, her wounds run deep, lifting the veil on the secrets they keep. They sold us comfort, they sold us lies, but the matrix cracks when we open our eyes. Doses of deception, silence our choice. She's restoring our freedom with a soothing voice. Medicine meets the matrix, no more disguise. Doses of deception, open your eyes.
What have you done for 20 years while the chronic illness epidemic just went on and on and on?
Needles and numbers, dollars and pain, profits in pockets, while sickness remains. Her voice is the cure for the broken in need. Hope takes its root as she's planting the seed. They promised healing, but sold us control. Her voice is the fire that's melting their hold. Doses of deception, silence our choice. She's restoring our freedom with a soothing voice. Medicine meets the matrix, no more disguise. Doses of deception, open your eyes.
People aren't going to be able to get it. That's right. Because they are less willing to take on that liability because they don't believe that they're safe and effective. They were only safe and effective when they couldn't be sued.
Never the wires escape their control. Awaken to the truth that can rescue your soul. Doses of deception, silence our choice. She's restoring our freedom with a soothing voice. Medicine meets the matrix, no compromise. Doses of deception, open your eyes.
They knew about this and the antidote was already available. That's what Operation Warp Speed was. And Big Pharma came in and warped it. Welcome to Doses of Deception. I am your host, BB McGuire. The following presentation is solely for informational purposes and is not intended to provide medical advice, diagnosis, or treatment. So please consult your trusted healthcare provider. Welcome to episode number 58, Doses of Deception. Today is Tuesday, April the 28th, 2026, and tonight, News Trees and Dave will be joining me, and we're going to be covering long COVID, the Glyphosate controversy, and SCOTUS, and the new cancer stats that just recently dropped. As you guys are piling in on Rumble, I would please ask that you would hit that like button, that little thumbs up, hit the bell That allows you to subscribe. And if you're enjoying the content, please consider hitting that repost and sharing the show. If you're in the chat, consider putting your post in the comments below the show. That way, folks who are watching the show on replay can be availed to your amazing wisdom that you guys are always throwing up in the chat. If you're watching over on X, please hit that little heart, drop a comment, consider sharing the show. I am so grateful for all of the support and for you guys sharing this information. You're getting this little show up on the leaderboard pretty frequently, and I am amazingly grateful. And you're growing this show, and it's all of your interaction that is doing that. And we're awakening more people to not only the lies, but more importantly, the truth. So thank you. Special thank you to the best chat moderators in the business, MedExam and Magadai. Team Doses work in the chat this evening. I'm going to go ahead and bring in Dave, and we're going to get this thing started. Hey, Dave.
Hey, BB. Happy Tuesday, I think
It is Tuesday.
Yes.
It is
Good
Tuesday.
to see
It's weird to be on the air Tuesday night, right?
you. Well, it's not like there's anything going on, So.
No, we've got nothing going on.
Nope.
So you were recently traveling last weekend. Tell us about your event.
Yeah, it was great. We were at the Awakening Summit up in Long Island, and my home roots there. And it was a great time. We had a whole bunch of really good people there. I think they probably had, I'm going to guess, close to 150 people show up.
Nice.
And it was cool because it was a very diverse group of speakers. It wasn't, just a Q group, but, you had folks like Joe and Scott from TrueStream there, Derek Johnson, Dr. Jan Halper Hayes
Nice.
showed up. So it was good. It was a great time. Personally, like anytime you can get together and go to one of these things, it kind of reinvigorates you. It's a great time. So many people came to see us, and just it was a great weekend. It really was.
Oh, that's fantastic. Wow. I'm glad that you guys had a great weekend, and I'm glad everybody got back safely and you're back, at the helm. So you guys had a great show this afternoon. If you guys are not aware of News Trees, and I'm sure most of you are, but if you're not, his contact information is in the description below the show. It is definitely worth checking out if you are not familiar. So I want to start the show tonight with breaking news that occurred this afternoon, which I think is huge. I'm going to make this big so everybody can see it nice and big. So former senior NIAID official indicted today for concealing federal records during the COVID-19 pandemic. David M. Morenz, 78, of Chester, Maryland, not too far away from where I am right now, is charged with conspiracy against the United States, destruction, alteration, or falsification of records in federal investigations, concealment, removal, or mutilation of records, and aiding and abetting. Morenz served as senior advisor in NIAID's Office of the Director from 2006 through 2022. That would be Fauci, guys. And that's quite a few years that he would have been privy to what was going on in that Office of the Director of NIAID. Acting Attorney General Todd Blanche said, "These allegations represent a profound abuse of trust at a time when the American people needed it most, during the height of a global pandemic." As alleged in the indictment, Dr. Morenz and his co-conspirators, that's pretty tasty, well, they deliberately concealed information and falsified records in an effort to suppress alternative theories regarding the origins of COVID-19. He goes on to say government officials have a solemn duty to provide honesty, well-grounded facts, and advice in service of the public interest, not to advance their own personal or ideological agendas. What do you think of that?
I love it. I love it. And, we were having this conversation on the air today. These things happen, and, you can almost sometimes hear like a collective groan from the hardcore truther movement, like, oh, big deal. That's nothing. It's not Fauci, whatever. But I don't know. I always try to remind people that, like, I kind of look at this like, imagine if you're one person and you're trying to move six cars down a roadway at the same time. It's like you pull one forward, then you got to go back. You pull the next one forward, and that's what they do with these narratives, right? This
Hmm.
is, of course, it's not the big ones that we want, and it's not a household name. But like I was mentioning on the air today, imagine if they indicted Fauci today. Now, yes, that would cause a lot of discussion. We would all be happy. That would also dominate the entire news cycle,
Yep.
right? And it would prevent us from achieving other important things that I think are going to come full circle when this is all said and done. So right now, I think it's pretty obvious to everybody that for a while, for the last few months, there's been a big focus on the media, right? Again,
Hmm.
doesn't matter what you believe did or didn't happen on Saturday. The narrative that came out of it is this 10-year rhetoric, this hit campaign against the president that is causing it.
Yep.
And you have the Jimmy Kimmel thing, right? So they're continuing to chip away at the media. And I think the reason you're not seeing somebody like a Fauci yet is because I believe that by the time like something like COVID comes full circle, they want people to be able to connect the dots that the media was a part of it. And as
Oh, I
much as
agree.
we know that, right? If you indict Fauci tomorrow and you say, look, a lot of this was a scam, whatever, people would just focus the normies would focus all
Hmm.
their venom on Fauci and a few other people. They're not going to connect the dots on their own that the media was complicit in this.
Oh, yeah.
So I think it's like as much as people want it, I do see what they're doing here. They want it by the time we get to the real hardcore stuff of COVID, they want people to understand, to have enough background knowledge of this other stuff to connect the dots, right?
Hmm.
Epstein would be a part of that too. Well, how did all the government people go with it? How did Congress go with it? Well, they were being blackmailed by Epstein, right? So there's a lot
Right.
of these narratives I think that they're setting up, and I believe that they're putting stuff out there like this. It's just another reminder, like, don't worry, we have it all. Like, that's how we should be looking at it, and it's a conversation piece for people, and they'll
Yeah.
just continue to do more and more of this. And by the whenever it is, by the time the big stuff gets there, I think they're setting up in a way to allow people to understand the full picture of what was done. That it wasn't just Fauci, it wasn't just this one person. It was this systemic conspiracy
Yeah.
that led to all this.
Well, what's interesting is that I really kind of focused on the charges because I think that this is like fertile ground that they're laying. I mean, think about how many different people might be facing similar charges. Things like conspiracy against the United States, destruction, alteration, or falsification of records. And one of the charges is that he used his private email server to avoid FOIA. Gee, I mean, I remember a Secretary of State, one Hillary Clinton, who did that, right? As well as President Obama using private emails. So it's real fertile ground. And then um, over on X, General Flynn responded to the indictment saying, they called you a conspiracy theorist for asking questions they were actively hiding answers to. That ends now. Accountability is not optional. So that was a strong statement. And
Right.
then just for giggles, I threw this into Grok as it was coming out. And because in the indictment, it talks about that he's there are other co-conspirators. So the two unnamed co-conspirators not charged, at least as of now, the first one is Peter Daszak, who was the then president of EcoHealth Alliance, whose organization held the relevant NIH grant involving Wuhan research. And then the co-conspirator number 2 is likely Gerald Cush, who was an associate director at Boston University's infectious disease lab. I then asked Grok to speculate on other indictments that may be coming as a result of this. And Grok went on to say that Anthony Fauci, not named in the indictment, but Marins referenced back channeling to a senior NIAID official, one, widely believed to be Fauci, and claimed awareness. Congressional probes examined Fauci's possible use of personal email and knowledge of Morin's actions. So more to come, I believe.
Yeah, and that second co-conspirator is interesting to me. My beloved, I say that with a grain of salt, alma mater, Boston University. People remember, I think it was back in 2022, there was a news story that came out, kind of came in and out of the news cycle, that they got caught in one of their labs synthesizing a version of COVID that was supposedly like 80 times more deadly
You're
than the one.
kidding.
Yeah, that was a in and out of the news cycle very quickly. 22, 23, somewhere around there. That story came out and it kind of just went. And
Wow.
so there's another
Oh,
little
oh
connection
no, I
there
got
that
to
I'm,
dig on that.
yeah,
Boston Lab. Yeah,
yeah,
I'll be digging on that one.
yeah.
Wow.
Yeah,
Wow.
so it's it's a long, arduous process. I get it, but like General Flynn is saying there, I think he's giving you a big clue about the active suppression and all that other stuff, and that is ultimately going to involve big tech and the media and everything else. So
Oh yeah.
a lot more to come. A lot more to
It's
come.
coming. It's
But
coming.
the way they look, what I tell people that are growing impatient with the entire process is, if you were sitting here and can you think of any, I don't know, 2-month period over the last 6 years where there hasn't been a major story about COVID? No, the answer is no. There's always, every couple of months, there's something. And that to me is like your breadcrumb trail,
Hmm.
right? They're doing it in a way to remind you that this isn't going away. And every time they do something like this, small as it might seem, watch over the next few days and weeks, you're going to see the usual subjects, guys like Tucker, and I'm sure Joe Rogan will be all over this, right? And it's just
Hmm.
giving people the opportunity with these big audience to recycle these news stories. And that's how they do it, how they keep things in the conversation space, in the infosphere, and it's not going away. Slow as it may be, it's not going away.
The other thing that I found interesting was that, you guys have talked about, the actors, the secretaries, the pretty ladies who were front and center, riding their horses on the border and standing at the podium and talking about how tough the DOJ is going to be. Meanwhile, behind the scenes, we've got, for lack of a better term, ball busters at work, right? And, just in the 26 days since Bondi left that AG position and acting AG Todd Blanche has been in position, who, by the way, represented Trump in 3 different court cases, right, where they were going after him during the Biden administration. He has indicted the Southern Poverty Law Center, the Morin's indictment, and the Comey indictment in 26 days. And, raiding, the Somali daycares again.
Right. And look at what's going on. Yeah, you're going to get your expected pushback from the left or whatever, but look at what it did. Whatever you believe Bondi was or wasn't, I have my opinions. I believe that was the design, right? That
Hmm.
she was there. Everyone gets excited when Trump comes in. All right, the hammer's going to drop, and then they spent a year of just like fraud, corruption, nothing getting done. And what did that do? It it made everyone's appetite for indictments that much larger,
Absolutely.
right? And now he comes in, and I wouldn't be surprised if something happens with him and he doesn't indict people. This is what they're doing. It's a clear pattern. So now you did that, and you got everyone riled up, and everyone looking like, oh my God, she's corrupt. She's not going to get anything done. Move her out of the way. Bring him in. And he starts dropping the hammer, and everyone's
And
okay
then
with
that
it.
pot will get put on the back burner and another pot will come forward.
Exactly right. Yep.
Yeah.
Yep.
Wow. All right. Well, this one grabbed me this week. Everyone wants the truth until it goes against what they believe. I think we've experienced this, particularly since Saturday. Would you agree with that?
Yeah, I
Yeah.
would. And we there's a very interesting thing going on right now, which is like, as you mentioned, we talked about on the show today, that you had a number of people on Fox News who, first of all, MTG comes out, right?
Hmm.
MTG comes out a week before this entire thing happens on Saturday and basically insinuates that Butler might have been a hoax, might have
Hmm.
been staged. And 2 days before Saturday, CNN prints a piece about how you could stage an assassination like Butler. And 1 day before the assassination, Erin Burnett does an entire piece on people believing that Butler was staged. And then Saturday happens. And today, Fox News of all people is out there basically telling people you're insane if you're questioning any of this as being real. And I would argue, sure, plenty of normies will believe that, but also a lot of people will look at that and it'll have the exact opposite effect. We don't live in the same environment we did 5 years ago.
No, we don't.
I'm not saying for every person out there, but for a lot of people now, they don't want to be told, don't question something. Don't look at this. You're a crazy conspiracy theorist. So I just find it interesting that now, right? Didn't happen after Butler, didn't really happen after Charlie Kirk, but now after this one, there's this like coordinated narrative, like, don't question anything. This is exactly what happened. And in my opinion, for a lot of people out there, it's going to have the exact opposite effect. They're going to reject that notion. Don't tell me what to think.
Oh, yeah. Oh, yeah. Definitely. Well, speaking of telling the truth, I'm going to make this big so you guys can see it. Aaron Siri on X posted that someone sent him Kaiser internal scripting guidance concerning shots and medications for newborns, specifically vitamin K shots, erythromycin eye ointment, and hepatitis B shots. The scripting includes, these medications are part of our standard of care. It says, how we present this information to families can significantly influence acceptance. Avoid framing any of this as optional for the parents. Be prepared to explain the benefits and the purpose. Importantly, guys, what it does not say is to be prepared to explain the risks, because medical providers use scripting all the time. And they're being trained. We, as medical providers, are trained to use scripting. I'll give you an example. In many institutions that I've worked at, and if you're a patient in any institution, you will be contacted usually by a third-party vendor for patient satisfaction scoring. And they'll ask you a series of questions on, are you satisfied with the care that you give? One of those questions in the past was, did the providers give you privacy? Did they make arrangements for your privacy? So one of the scripts that we were given was to bring front and center to your mind, again, to manipulate your answers to the questions for patient satisfaction, was to say things like, okay, Dave, I'm now going to close the curtain for your privacy. Dave, we're going to close this door for your privacy. So I'm scripting that for your privacy, so it's front and center in your mind when you're asked the question, did the nurse, provide for your privacy? So scripting's used all the time. But in that one, they're literally training people to come in and tell you what you're getting today. Examples like, well, in your doctor's office or your pediatrician's office, well, today you're due for, or we'll be giving you. They're not asking you a question. They're certainly not asking consent to give anything. They are telling you what they're going to do. So my question is this actually informed consent, or is this manipulation into compliance?
It's absolute manipulation. And I'll take it a step further. There's a fancy little term that they teach you in sales. Anybody that's worked in sales knows what objection handling is called, which means, I'll
exactly.
give you an example. It's the process of taking a product that you're selling and understanding what the different objections people may have before they ask them, and preparing your sales staff to be able to address that, right? So if, let's say, you're representing a car brand that's known to have problems. So, people are going to say, hey, I heard that these cars have a lot of problems. Well, one of your objection handling would be like, well, no, actually, we give you a 10-year warranty. And did you know that on average, the cost of care for this car is 30% less than other car brands, right? It's the process of spinning people away from the problems that they're going to ask before they even ask it. And I honestly, I can tell you this from personal experience. I was married to a farmer rep many years ago. And one of the things that these farmer reps are trained on is objection handling, and they're scored on it, and they're paid based on it. So,
Wow. So they're just
yeah.
kind of adopting this and bringing it into medical providers and having them do the same thing.
Oh yeah, like I won't mention the product that she represented, but I do remember in particular one time I think there was some kind of big lawsuit or something like that was going on with side effects and whatever. And I remember them training her on, what do you do? Training her to train the doctors on what to say if they're asked about this particular lawsuit. And they literally had
Wow.
scripts, and the reps had to memorize the script, go to training at the company, pass an exam in order to keep their job so that they could go in and, quite frankly, brainwash these doctors and
Ugh,
nurses into objection handling, understanding how to spin people if they ask the truth about their products.
wow.
Yeah.
Well, this is another example. This is why your doctor actually gets aggressive. Blue Cross Blue Shield pays your doctor a $40,000 bonus. Now, this is in pediatricians' offices. $40,000 bonus for fully vaccinating 100 patients under the age of 2. If your doctor manages to fully vaccinate 200 patients, that bonus jumps to $80,000. But they lose the whole bonus unless at least 63% of the practice is fully vaccinated, and that includes the flu vaccine. So it could be the entire whole bonus on your child's head. So to your doctor, your decision not to vaccinate your child might actually cost them $40,000 or more. And this data is actually from 2016 Michigan Blue Care Network incentive program. Today, similar incentive programs are now part of a broader quality improvement or pay for performance incentives. And so, like in a standard adult practice office, it would look like, are all of your patients over the age of 50 on a statin?
Yep.
Or, are all of your diabetics taking metformin? And it's always pharmaceutical and vaccine based, these insurance bonuses. It's disgusting. So,
It's a,
the thing that,
BB, it's a double-edged sword too, right? Because you have these reps and these people that represent that work for the companies that are going in and creating an environment where, quite frankly, the doctors don't even have a chance to know that I'm not here to defend all the doctors, but quite
right.
frankly, they're coming out of a Rockefeller system. They're trained into this stuff for
Yep.
decades in many cases. And then even if they hear little snippets of something isn't good here and there, these reps come in. That was another thing they had to do. They have to do what they call clinicals, right? Which is they have to come in and give the doctors a number each month of new reports on how good this product is. And a lot of the conferences they go to, as I'm sure you all know,
Mm-hmm.
are sponsored by the pharmaceutical companies, right? So you have a system where the doctors look.
They're just
I
getting
don't
propagandized by
Yeah, I
pharma.
don't believe that they're sitting there going, I want to make my $40,000 to poison people, right? I think that it's they believe these things are good,
Yes, they
right? So
do.
they
They
already
do.
think they're good, and then they get a bonus on top of it, and those two things combined is a deadly combination. Because on one hand, they're sitting there saying you're dumb for not vaccinating your kids, and on the other hand, of course, you have that little, not so little, financial incentive that's going to be just more reason to push it.
Oh yeah, absolutely. Well, I just think it's important for everybody to understand when you walk into a doctor's office, all of this that's going on behind the scenes, because you can no longer walk in and just assume that the information that your doctor is presenting you is for your good. As you can see, there's a lot of stuff behind the scenes that is being, manipulated and in my opinion, it's just pharma propaganda.
Yeah, and
So
and BB, pro tip, I know you know this. Everything we're saying here applies to the veterinary industry as well.
absolutely.
It's the same companies, it's the same business model, it's the exact same
Yep.
problems. And in
That's why I
fact,
won't bring my
it's
dog. I won't bring
yeah,
my dog to the vet anymore. No
yep,
more.
yep.
No more. Well, I wanted to share this with you guys because he is just banging out some great stuff. This is Sam Mahol on X. And it's interesting to me that more and more of the Maha folks are highlighting him. So the year is 1956. Your doctor tells you to eat margarine instead of butter. The margarine is industrially hydrogenated vegetable oil with a trans fat content that will, 40 years later, be classified as one of the most harmful substances in the food supply. Your doctor does not know this. Nobody's asking. The year is 1961. Ansel Keys is on the cover of Time magazine, bespectacled and certain. Your doctor now tells you to reduce animal fat. The evidence is a study that initially looked at 22 countries and was published with 7. France, which eats butter by the kilogram and has the lowest heart disease rates in Europe, is not one of them. The hypothesis is now a consensus. The consensus was built by excluding the data that disagreed. The year is 1977. Senator McGovern releases dietary goals for the United States. Cut fat, eat complex carbohydrates. The food industry hears this as bread, pasta, cereal, and an enormous commercial opportunity. Your doctor starts telling you to eat 6 servings of grain a day. You lose weight briefly and then gain more back. Your doctor suggests you try harder. The year's 1984. Time publishes another cover, 2 egg yolks and a strip of bacon arranged into a frown. Your doctor stops letting you eat eggs. The correction that dietary cholesterol barely affects blood cholesterol for most people will arrive in 2015. The year is 1992. The food pyramid arrives. 6 to 11 servings of bread at the base, fats at the apex to be used sparingly. Obesity rates, stable for 30 years, begin to climb almost immediately. Type 2 diabetes follows. Nobody connects the two because the pyramid is official, and the official things cannot be questioned. The year is 1995. Snackwell's fat-free cookies overtake the Oreo as the best-selling biscuit in America. They are sugar and refined flour. Your doctor sees no problem with them because they are fat-free. The year is 2018. Your doctor tells you red meat causes cancer. The evidence is a hazard ratio of 1.18, which in any other field of science would be considered noise. Your doctor does not mention this. Nobody told your doctor either. Now it is today. Your doctor has new guidelines. Protein is back. Saturated fat is being quietly rehabilitated. Refined carbs are, at last, the villain they were always going to be. None of the doctors who told you otherwise have phoned to apologize. None of the institutions that enforced the last position have issued a correction. The file simply updates. The old guidance vanishes from the website. The textbooks get reprinted. The medical students are taught the new version as if the old version never existed. And the patients, who spent 40 years doing what they were told, are expected to quietly update their diets and move on. Your great-grandmother was right. Your grandmother was right. Your mother, who followed the guidelines, is on 3 medications. The pattern is not subtle. The pattern has never been subtle. The only question is how many more cycles of this are you willing to sit through before you stop asking the people who got the last one wrong what to do about the next one. That is awesome.
Nailed it.
Yeah.
Absolutely nailed it. And look, there's so much we could dive into on that, but just a couple that jump out on me. Obviously, the entire game with don't have any fat in your diet, and at the same time they were playing that game. As you well know, they were quietly every couple of years ratcheting down the level of what they considered to be acceptable cholesterol, so that people would test higher.
Yep.
And they put everybody on statin drugs. And what happened over the last 30, 40 years is Alzheimer's went like this.
Yep.
And, once again, Joe Rogan was right. Few years ago, maybe even 3 years ago now, he had on, I forget the gentleman's name, one of the most demonized scientists out there, who had been quoting the Framingham study.
Yep.
And Framingham study is, I believe, if not the longest, one of the longest continuous medical studies of all time, which basically showed that it's actually the complete opposite, that the fat and the cholesterol within reasonable levels is actually what keeps you from getting Alzheimer's, the complete inversion of reality. And the don't eat fat and keep your cholesterol low and go on a statin is, in my humble opinion, exactly correlated with why all of a sudden so many people have dementia and Alzheimer's and everything else. It really it's tragic when you think about it. When you everybody watching, you start to think about some of your family members and what they're either going through now or have gone through or are no longer here. It's all outlined right there in that post.
Absolutely. Absolutely. Well, I've shared on the show, my mom died a little over a year ago, and she died from vascular dementia. And it was a horrendous, horrendous thing to go through that with her, and to watch her essentially, in my opinion, be poisoned by the food that she was eating and the pharmaceuticals she was taking. Yeah, it
Yeah.
just was.
And BB, what makes it so tragic is, unfortunately, everyone watching this show that's living through the Great Awakening knows that even with everything that's outlined there, when people go 10, 15, 20 years of being told something, and then even if there is a new report that comes out and they change it, well, people are creatures of habit, right? They're not going to change their diet overnight just because something happened. Prime example, you and I have talked about this a lot. I have a number of friends right now, one in particular that I'm thinking of, who have friends and family that are dealing with cancer, right? And we have
Hmm.
clinical report. I mean, we have so much information on ivermectin and fenbendazole, mebendazole, and the effectiveness. And I am frightened, quite honestly, by the number of people that I either know personally or in our community, or they call into open lines on a Friday and they're talking about they have somebody who is, in many cases, stage 4, or even dying of cancer, and they won't take the ivermectin fenbendazole protocol
Oh,
simply because
yeah,
they're
they're,
indoctrinated into
yep,
what their doctor says. And I'm sitting there going, my God, if God forbid I was in that situation, if you told me to go out and eat horse crap, I'll do it if it
yeah,
works.
yeah,
If I'm in that point,
yeah.
but that's the other problem. It's not as simple as just changing the protocol. Anybody that's ever tried to show people this stuff and has gone through the arguments, you're crazy. People don't just switch overnight. So there's a residual effect of the people that are still stuck on the old ways and will be for a long time.
Oh, yeah, yeah. I had a half brother who died within the last year. He was in his 40s, left behind a wife and two small children.
Hmm.
Um, he got diagnosed with melanoma, and I talked to him about alternative therapies. He was afraid. He wanted to, follow the standard protocol that medicine was offering him. And a year later, his cancer had metastasized everywhere, and that's when he became willing. But at that point, it was far too late.
Yeah,
So, yeah.
yeah.
All right.
Tragic.
So, Steak and Shake is actually taking a Maha lead in the fast food market. Starting on June the 1st, all of their steak burgers are going to be made with 100% grass finished beef. I have a little video.
And the Maha movement gaining momentum. This is a pretty interesting story. There's a famous fast food chain that is now embracing the health kick. Steak and Shake announcing it has hired its first chief Maha officer. The White House posting this. Awesome. Michael Bose is this man, and he joins us here. Thank you so much for being with us. What's it like to be the first?
It's first of all, it's exciting to get the approval from POTUS. So it's an exciting time, I think, for the food industry and for the food environment for Americans.
And tell everybody about your background that makes you the right person for this moment.
Yeah, so I actually served as a senior advisor for HHS under Secretary Kennedy, and my main project was the new dietary guidelines for Americans. So we were the ones that flipped the pyramid upside down.
This just felt like everyone from a bipartisan standpoint was like, yeah, okay, this makes sense. People could quibble with some things, but Steak and Shake, when I think about, wow, I really want to eat healthy today, I don't think I'm going to go to Steak and Shake. How might you change that?
Yeah, look, the reality is Steak and Shake, the owner, Sardar, believe that Americans deserve the highest quality food, and that's simple, clean ingredients that people can pronounce. And the reality is this is what fast food was 50 years ago. Something happened 30 years ago where this industrialization occurred. And Steak and Shake is taking a bet and realizing that American consumers want the highest quality ingredients in the world.
So they're leading out. And he's talking about grass fed. And so I wanted to just tell you guys the difference between beef that is grass fed and beef that's grass finished. So grass fed indicates that the cattle ate grass for a portion of their lives, but they may have been finished or switched over to grain, right? So then they could be exposed to things like, glyphosate on the grain. Grass finished means the animal ate only grass throughout their entire lives. Grass-finished beef has higher omega-3 fatty acids and other essential fatty acids and vitamins like A and E. So, yeah, much more healthier. It's clearly more expensive, but definitely more healthy. But man, this is leading out. I loved what he said about we're going back to where we were 50 years ago.
Yeah. Yeah. And the reality of the situation is if you've ever read any of the works, I study, I enjoy reading books of very, very successful businessmen, not necessarily because of the financial side, but what they did. And what you find is, quite honestly, most of the um, extremely successful business owners in the world are people that are like us. They're truthers. They're ahead of the curve. They learn how to read the tea leaves, right?
Mm-hmm.
And so, I know a lot of companies out there right now in the Patriot movement or have people that are adjacent to the Patriot movement that are making these kind of moves. And it's going to be very interesting to see how this plays out because the information is getting out there. And what you're going to see happen over the next 5-10 years is the companies that are paying attention to the stuff we're talking about are going to adapt and are going to change. And the ones that don't are going to fall by the wayside because part of what has come out of this horror show that we started the show with, which is COVID, is an awakening across the board of all of this stuff. And of course, no, it doesn't happen overnight, but companies like that are smart. They're reading the tea leaves and they know that if you sit back and continue to serve garbage to people, sure, you might be around for a few more years, but long term, you're going to end up like Blockbuster Video.
Oh yeah, definitely. So are any of you guys still buying Nutri-Grain bars and throwing them like in lunch boxes, thinking that they're healthy? Ooh, think again.
Lab-made strawberries are finally being exposed. Kellogg's is now named in a landmark lawsuit for using tobacco tactics to hook kids on a 50-ingredient fruit dyed to look like a strawberry.
One Nutri-Grain bar hits you with 58 factory additives. That red in the middle, it isn't strawberry, it's refined glucose, dyed red in pressure kettles and glued with methyl cellulose, the same compound used to hang wallpaper. The crust is worse, hexane-stripped oil, crammed with actual iron filings and laminated with 3 chemical gums until it can sit on a shelf for 9 months.
Yeah, that's healthy, right?
Oh yeah. Yeah. I mean, who doesn't want to put that in their body?
Right. And what about dryer sheets? Anybody still using dryer sheets? Ooh, let's take a look at that.
Stop using dryer sheets. These are super toxic and there's a much better natural option. Dryer sheets might leave your clothes smelling super fresh and flowery, but they are full of toxic compounds. What's in here? When you use dryer sheets in the dryer, it off-gases carcinogenic gases like benzene and irritating compounds like acetaldehyde. There's also fragrances in here which are phthalates. They're endocrine disrupting, and these get stuck in your clothes and then absorb through your skin. Furthermore, there are things called quats, quaternary ammonium compounds, which are waxy substances meant to stick to your clothes, and they're linked with skin disorders, potentially worsening of asthma, irritation, and eczema. There's absolutely no reason to use dryer sheets. These are totally toxic. It's giving me a headache just holding these things. They are so fragrant. There's a super easy, simple option. Wool balls. Super easy. You just throw those in the dryer. Why would you use such a toxic thing as a dryer sheet when you could just use wool balls?
That's what I'm using now. Yeah, we moved away from that. And I anytime I have men on the show and we talk about like those phthalates, endocrine disrupting chemicals, I tell folks, hey, you know what that means, guys? That means testosterone.
Yeah.
So, put that tape in and let it play all the way through. If you're lowering your testosterone, what might that do?
Yeah. And you know what's also really cool about this, BB, is part of what we're doing, this show is an example of it, right? We talk about how part of the Great Awakening is decentralization of everything, right?
Right.
Government, finance, health, whatever. And wool balls, easy option. But because people have started to figure this stuff out, there are a lot of great companies out there that are making natural dryer sheet alternatives. And FYI,
go ahead and hit that.
They're not super expensive. In fact, I'm blanking on some of the companies off my head. And my mom has some in the house. That there was one company, but these are smaller companies. their advertising strategy is not Fox News and all that, because quite frankly, they can't afford it. So what they're doing is they're advertising with people on YouTube and Rumble and things like that. And it's creating, as people wake up, it's creating new opportunities. And so there are alternatives out there, and they don't have to be super expensive. Second thing too, by the way, and again, I'm blanking on the name of it, but if you guys Google, you'll find it. If you're overwhelmed by ingredients, I see a lot of people saying, how they read ingredients, and a simple rule is if they have a lot, you should probably stay away from it. But there's a bunch of apps out there right now where you just hold your camera over the barcode, and it'll read the ingredients and give you a score and tell you what's good, what's bad. So there's a lot. You don't have to be overwhelmed by it. You could just sit there in the supermarket with your phone and at least have a fighting chance. It'll help you out with a lot of this stuff.
And I tell folks, if you just make one better decision a day, right? Just eliminate one toxic exposure a day. Just one. Over time, you're less and less exposed, and there's less and less toxins in your life, right?
Yep.
So just one better decision at a time.
Yep.
So
Exactly.
you and Joe were talking about Rogan and how he's front and center, kind of moving the needle on public awareness, right? So he recently introduced nattokinase to his massive audience. I'm going to play that for you.
Have you seen the work they've done on nattokinase? I'm not sure if I'm saying it right. And its impact on arterial plaque?
No.
Hugely beneficial. It comes from fermented seaweed from natto. So this Japanese use of fermented seaweed. So in meals that they've isolated it into a supplement. And this supplement, nattokinase, they've shown that it reduces a massive amount of arterial plaque. So here it is, high-dose nattokinase, particularly at 10,800 FU day, has shown to effectively manage arteriosclerosis by reducing carotid artery plaque size by 36% or more, decreasing intermediate thickness and improving lipid profiles. It acts as a potent fibrinolytic? How's that word?
I don't know that word.
Fibrinolytic.
Yeah.
Fibrinolytic agent that may also break down amyloid plaques. Isn't that fast?
So he's talking about nattokinase, and he said it's from fermented seaweed. It's actually fermented soybeans, and it's a protease enzyme, and it actually breaks down fibrin, which makes it a fibrinolytic, meaning breaks down fibrin. And fibrin is a protein that's key to blood clotting. So the study that Rogan is actually referring to in that clip is from 2022, and it had over 1,000 adults with an average age of 67. They were given high-dose nattokinase, and that's nattokinase, nattokinase. And they were given 10,800 FU daily. That's how it's dosed. It's called infraction unbound. And they were given that daily for 12 months. And it was linked to 36% reduction in the carotid artery. That's the arteries that run on both sides of your neck that bring oxygenated blood to your brain. It reduced plaque sizes by 36%, measured by ultrasound. Nattokinase is also showing promise in lab and animal studies degrading amyloids. And amyloids that he was talking about are misfolded proteins that form these fibrils and plaques in Alzheimer's. So here's Nick Holscher explaining a little bit more.
Yeah, this is absolutely huge. So a natural and safe enzyme derived from fermented soybeans can literally, proven now experimentally in the test tube, dissolve 84% of the total microclot count in 2 hours. And so this is the strongest evidence we have that this can actually get rid of amyloids. And we had no clue really what could before. We didn't know if these enzymes could do it, but now we do know that yes. And now this was not in vivo, this was not an animal, but regardless, we do know it can happen. We do know when you ingest nattokinase orally, it does reach systemic circulation and will likely also exert effects on the circulating amyloids. And so what needs to happen next is human testing, human trials to assess the reduction in amyloid burden and spike burden from the nattokinase. We have to remember one more thing. This nattokinase presents dual action activity, where it also has been shown to degrade the spike protein or frame-shifted proteins themselves, which are the very triggers that induce the amyloids in the first place. So you're knocking out the trigger and the pathogenic outcome. So this is very, very, very promising. And also, it is very safe.
Yeah, I take nattokinase every day. Now, what I will tell you is my experience with nattokinase. It's all about the quality. So there, you have to do your due diligence and find quality companies producing nattokinase. For instance, I've said before that I get most of my supplements from the Now brand. It is a family-owned small company, and their quality standards are so high that when nattokinase was being used a lot during COVID, they would have periods where they would be out of stock because they were not willing to compromise their quality standard and get substandard precursors that they use to put it together. So, quality is important.
It is, and it's interesting. I'm sure you know what blue zones are, right? Like areas of the world where people outlive, everybody else, and many of them are over in Asia. And if you look at what do they eat over there, they eat a lot of fermented foods, fish, other things. One thing that actually goes really well with nattokinase that I take is a kimchi supplement, because kimchi is fermented cabbage, right? And it's got a whole host of things that help with gut health and cholesterol and all those other type of things. So those weird people over in Vietnam and Cambodia and everything else that seem to live way longer than we do and have all these ancient traditions that go back 1,000 years. I think they might be onto something.
Yeah. So 5 of RFK's 7 children have allergies. So what happened? Let's take a look at what he's talking about.
Became involved, as you pointed out, because I had a son who was severely anaphylactic to not only peanuts, but all tree nuts and a lot of other stuff. He made, I think, 22 emergency room visits by the time he was 2 years old. And so this really focused my attention. He came close to dying so many times. And as you know, the whole world becomes hazardous. You send your child to a birthday party, and maybe the cake had, peanut oil, or somebody cooked in the same pan something with peanuts in it 2 days before. And so everything is a trap, and everything is a potential killer of your child. I really focused my mind on it, but and I was focused on, okay, what are we going to do to treat it and to prevent him from getting sick? And I also, my mind immediately went to the place of, why is this happening? 5 of my 7 kids have allergies. What happened? Something happened. And it appears to have happened sometime around 1989, 1990. So you have to look at an environmental toxin that became ubiquitous during that year across all the different demographics, from Cubans in Key Biscayne, Miami, to Inuit in Alaska. Everybody started getting these allergies at that time. And why have there been no studies on that? Why are not people looking at that? Why isn't the entire scientific community focused on saying it's a very easy studies to do?
Gee, BB, what happened in 1989 and 1990?
I will tell you. An environmental toxin that became ubiquitous in 1989, 1990. The Hib vaccine, Haemophilus influenzae type B vaccine, and that is given for meningitis, pneumonia, and epiglottitis. And it rolled out in 1990, and it contained aluminum adjuvants. Aluminum is now the most widely used vaccine adjuvant, and an adjuvant is used to enhance our immune response to the vaccine. So aluminum actually promotes inflammation that recruits immune cells and promotes our bodies to make antibodies, right? So aluminum is actually used in labs on purpose to cause allergies in mice. They mix a harmless protein with aluminum and then inject it into mice. The aluminum then supercharges our immune system. It makes that mouse now develop real allergy symptoms. Let's take a look at RFK talking about aluminum in the lab.
How do you give a food allergy to a rat? I'll tell you how. You give them the aluminum adjuvant from the hepatitis B vaccine with a peanut protein, and that rat will now have a permanent peanut allergy. You give him the aluminum adjuvant with a dairy protein, and he'll have a dairy allergy. You give him the aluminum adjuvant with a latex protein, and he'll have a latex allergy. We now know, and so you have these vaccines that not only had that aluminum adjuvant in them, but they had peanut oil excipients in them. So we gave a whole generation peanut allergies. We also know that the allergy occurs not just to other ingredients in the vaccine, but if you get that aluminum adjuvant and there's something in the ambient environment at that time, you can now have an allergy to that. So if you get that aluminum adjuvant, that hepatitis B vaccine, at a time when there's a Timothy weed outbreak, that child may now have a permanent allergy to Timothy weed. And there's a study by Mawson that shows that children who got that vaccine have 30 times the rate of allergic rhinitis as children who are unvaccinated. You wonder why all the Claritin is being sold and all these kids have allergies today. It comes from the aluminum in the vaccine.
Yeah.
1986, they passed the law that basically gave immunity to the vaccine companies, and it was right in 1989, that 1989-90 period was that, and they added even more. And it's just one of those things. I obviously didn't have kids, so I wasn't that dialed into like what was going on in schools. But at some point you wake up and you're in your 40s, and you now have people in our office that are working for me that are in their 20s and everything else. And I'm looking around and I'm like, what the hell is going on?
Everyone's allergic.
Everyone's allergic to everything. And then I have, my friends, as my friends start having kids, they're telling me like, you can't even, it's like, you can't even bring a peanut butter sandwich onto the campus of a school. And I'm sitting there going, God, back in the day, my parents would take us to Disney World to be on a flight to Orlando. If you've ever been on one of those flights, it's 90% kids, and they were handing out peanuts. Like what the hell happened? And
right,
it really was this one. When I learned, it was a really big wake-up call for me, because I got to be dead honest with you, BB. When at one point when I was living in the city, just through work and everything else, I ended up with a group of friends that were about 15 years younger than me. So they fall right into that born in 1987 to 1990 time period. And I have to be honest, like it's part of my penance. Like there was a lot of like this group of people had so many issues that we used to run around joking. And I'll say this, I have no problem saying it. Like, especially as a guy, with some of the women, like, stay away from these women in their late 20s. They're all crazy. They're all crazy. Right. They have all these problems. No, they're all poisons.
Yes.
They're all poisoned. And then they get thrown on SSRIs and everything else. And I remember one day just looking, I'm like, this doesn't make sense to me. It's like everyone my age is like fairly normal. We all have our own issues, but like this group of people, oh my God, like one is crazier than the next, or one is sicker than the next. Yeah. It just didn't make any sense. And then you start to learn this stuff and you're like, oh my God, it's an entire generation.
An entire generation poisoned. Yeah. Well, an average 12-year-old child has received between 15 to 25 aluminum-containing injections under the standard CDC routine vaccination schedule. In the first 2 years of life, based on this schedule, between 10 and 15 injections with aluminum. And this is with a developing, immature immune system. So routine vaccines that currently contain aluminum is the hepatitis B vaccine, the diphtheria, tetanus, and pertussis vaccine, that Hib vaccine, the pneumococcus vaccine, the hepatitis A vaccine, and the HPV vaccine. And so if we're thinking about this, Dave, if aluminum supercharges our immune system, what exactly is an autoimmune disorder? Well, defined, it's a condition where your immune system attacks your own body by mistake. Antibodies are made against your own body. Like, I have Hashimoto's thyroiditis, which means I have antibodies against my thyroid. My immune system is attacking my thyroid gland. Other autoimmune disorders include, now think about this as I go through this list. In the Maha report, the incidences of these have just been exploding, and even in children. Insulin-dependent diabetes, rheumatoid arthritis, lupus, psoriasis, and celiac disease. There are currently more than 80 known autoimmune disorders. And yes, if you're asking the question, chat, the rates of autoimmune disorders have generally increased since 1990, paralleling the rise in allergies.
Yep.
Because we're supercharging our immune systems with aluminum in these vaccines. Well, March 30th, the FDA sent out reminder letters to more than 2,200 companies and researchers linked to over 3,000 clinical trials that appear to be missing their required results on clinicaltrials.gov. So this is actually the first push to enforce a 2007 law. It's called the FDAA Section 801, and that law requires that clinical trials be publicly registered and that they have the results posted on clinicaltrials.gov. This applies to drug manufacturers, biologics, as well as medical device companies. Dr. Berg reports on this. Let's take a look.
So in 2007, Congress passed a law, and it says if you run a drug study in America, you have to post the results, all of them, not just the ones that worked, but the ones that did not work and the ones that where they hurt people as well. And so it goes on a public website, and once 1 year after the trial ends, and that's the law. So, and when I say results, I'm not talking about we did a study. I mean the actual numbers. Did the drugs work on the thing you said that they were measuring? How many people got sick? How many people died? All of that is required by law. Because if a company runs 10 studies and only 2 out of 8 work, and they only show the good ones and suppress the bad ones, then the doctor and the patient are misled, especially in the consent form, the informed consent, when patients sign off that they know the risks and benefits. So that's the law for about 19 years. And the fine for breaking this law is about $13,000 a day per trial omitted. So every day they're late, the meter runs. 13 grand per day. So take a wild guess how many fines the FDA has collected in those 19 years. If you guess 0, you are correct. 0, not $1. So Oxford University did the math, and if the FDA had enforced the law, pharma would owe $19 billion. So, and this is where it gets interesting, because 3 weeks ago, the end of March, the new FDA commissioner, Dr. Marty Makary, put out this announcement, and he said pharma has been suppressing unfavorable clinical trial results. And he used the word suppressing, which means hiding, not showing, omitting. So this is like the first time a commissioner in that job has come out in the open and said it. I mean, he sent messages to 2,200 companies, 2,200, okay? And the message wasn't a fine. It was just saying, hey, we see you. We know you're out of compliance. You have to fix it. That's it. And you might say that's a little thing, but just take a look at the enforcement that happened in the last 19 years. The only letters that were sent out were like 8 in 19 years.
That's huge information. I did not know that.
I
And
never
it's
knew that. I didn't know that either.
and it's interesting to me because we've been reporting here that, all of HHS is using AI programs everywhere. So this enforcement program, I think, is being AI assisted, which is why they're able to go find those 2,200 that are not in compliance and hold their feet to the fire and actually enforce the law. And what he talked about was that those big numbers, the fines, that was only pharma.
Right.
That's not the biologics. That's a whole different category. That's not medical devices. I'll tell you guys, if you can still find it. My husband and I years ago watched a documentary on Netflix called Bleeding Edge. And it goes through the FDA approval process for medical devices. Man, that is an eye-opening documentary. If you guys can find it, that it's amazing. Again, it's called The Bleeding Edge. We saw it on Netflix, gosh, more than 6 years ago, because I was still not awake yet when I watched that documentary, but it did make me start questioning things. So interesting,
Yep.
right?
He's calling attention to something that at least I first saw back in 2021. And I believe it was Dr. Peter McCullough when he was on with Joe Rogan. He was explaining to people the process of clinical trials and what a scam they are, right? That they can, as he said, they can completely omit trials that don't fit their narrative. How about this? They can also essentially make up a reason to omit adverse results. I'll give you an example. It is literally, as it stands right now, legal for them to say, you know what? We had 30 people that died from this vaccine. And you know what we figured out? All 30 of them they all had the same favorite color. It was blue. And that skews the data. So therefore we're throwing that out. Like literally they can do that. So to your point with AI, I know there's a lot of people in our movement that are very wary of AI, but let me just give you a very quick 15-second example of where AI is going to level the playing field. I'm guessing somebody smart out there is already building this, or it may already exist and it's not mainstream yet, or perhaps Maha themselves is going to do it. But we know the games that they play in clinical trials. Well, if you've ever tried to read a clinical report, it reads like Latin and it's very long, right? Well, with AI, you have the ability, if you give it the parameters it's looking for, to be able to take any clinical trial for any drug and drop it in there, and in 15 seconds know if they're playing any of the games that we know they are. So I envision that in the not too distant future, one of the tools we will probably either get from Maha or be directed to by Trump and crew will probably be some kind of app where you can take anything, hit a button, and know exactly what's going on in 2 seconds in those clinical trials yourself without having to go through a gatekeeper or a doctor or something else. That's just one example of where AI is going to be used to prevent this kind of crap from happening going forward.
Well, I've been talking about, here that, one of the few places where pharmaceutical companies have to be honest and are the most honest is in those package inserts, right? That we all throw in the trash, right? You go to pick up your medicine, you open the box and you throw that folded up thing with letters that are this big, you throw it right in the trash. Well, you can go into the FDA. All of those package inserts are on the FDA website. You can go in there and grab that and throw it into AI and ask AI for very specific, questions, and even ask AI, hey, I don't understand what this says. Can you give this to me in more simple terms that I can understand? And you can be availed of that information on your own without a doctor who's, like you've already said, got a pharmaceutical rep in his ear. You can avail yourself of that information and make an informed decision on your own.
Yeah.
It's an amazing tool.
Yeah. And for people that don't know, that aren't, are still haven't used AI, when BB says copy and paste, like literally, if you have a link, the website link, you don't need the whole report, the link to the report, you take that link, you put it in AI and you start asking it questions.
It's
and
amazing.
Pull out everything you need.
Yeah, it's amazing. Well, now we're going to get into that cancer data that hit. The National Cancer Institute's SEER data, that's surveillance, epidemiology, and end results for 2023, was released on April the 22nd, 2026. And you guys might be wondering, Why is 2023 data just now being released? Well, SEER allows for a standard 22-month reporting delay after the end of the diagnosis year. So cases that were diagnosed, cancer cases diagnosed in 2023, were first submitted to the National Cancer Institute in November of 2025. The data then gets processed and released to the public in the spring of the following year. So we're right on time. What did the data show? Well, this is a big old graph. Overall, cancers, get this, Dave, in those under the age of 50, jumped 6.4% overall from 2021 to 2023 during the mass COVID vax uptake. You can see they marked where mRNA injections begin, and you can see those cancers on the rise from that moment forward. Let's see. Brain tumors are up 19.5%. Colon and rectal cancers are up 19.4%. Again, all of these are under the age of 50. Ovarian cancer is up 12.8%. Stomach, also known as gastric cancer, up 7.3%. And breast cancer is up 3.6%. Nick Hulscher was on with Jimmy Dore. Let's take a look.
This should be front page news absolutely everywhere. The gold standard cancer surveillance system confirms the mRNA injections were indeed inducing cancer. Brain tumors were up 19% in those under 50 years old. Central nervous system tumors, breast cancer, stomach cancer. The biggest one was colon cancer, 19% higher. And yeah, it's very worrisome, and it corroborates all three independent analyses, three of them, two of them in different countries. One was in Italy with 300,000 people. They found the mRNA injections increased the risk of three distinct types of cancers and overall cancer hospitalizations by 23%. And then we had the study in South Korea with 8 million people and 8.4 million. And they found those increased risks of 6 major cancers, comparing vaccinated to unvaccinated. And lastly, there was another analysis of different CDC data, CDC mortality data, and he found 138,000 excess cancer deaths in the United States alone since 2021. So yeah, these injections appear to have induced a cancer epidemic.
Yeah.
I mean, those numbers are just, I don't think anybody needs to be a statistician to know that type of increase in such a short period is literally statistically impossible without some major external factor. I haven't seen anybody yet, but I would love to see how they try to spin their way out of that one.
Yeah. Yeah. And, it's interesting because colon cancers were the highest, right? Under the age of 50. So, the standard medical screening for colon cancer is a colonoscopy. And most people don't even begin screening colonoscopies until age 50. Mm-hmm. So can you imagine being told you have, stage 3, stage 4 colon cancer at the age of 40? You're like, but I haven't even had my first colonoscopy. What are you talking about? Yep. Right? So this phenomenon, this cancer thing, is now starting to infiltrate mainstream media. Like so many other different things. You guys were talking today about, they're questioning shooting events on CNN. Well, now we have Katie Couric questioning cancers. Let's take a look.
And it's nice to see other journalists, mainstream journalists, corporate journalists, jumping on the bandwagon of conversations that we've been reporting on for several years now. One of them is Katie Couric, and she was recently speaking and something stumped her. She couldn't figure out why something was happening. Take a look.
All right. I had coffee with an oncology fellow about 2 months ago, and she said, I had a very rough day. I just had to tell a 21-year-old college student with no family history that he had stage 4 colorectal cancer. And I'm hearing more and more about people in their early 40s, 30s, even 20s being diagnosed with this disease at an advanced stage, often metastatic colorectal cancer. I can't even tell you guys how crushing it is. And of course, I'm excited about trying to figure out why this is happening. But there is something going on in our environment. It's not just obesity or a sedentary lifestyle. You know, it's a confluence of things that include ultra processed food, maybe microplastic, forever chemicals, overprescription of antibiotics. I don't know what is happening, but something is going on. And there's 17 cancers. 17 cancers are increasing among people under 50. So what the is going on?
Indeed, the same question we've been asking, what the F is going on, Katie?
17 cancers.
17
Dave.
cancers, huh?
17 cancers increasing in people under 50 from Katie Couric. 17, twice.
I'm going to say two things. Please don't get upset with me. Number one, do I know that this is actually happening? Yes, because I personally know of a family friend in their 30s that got turbo cancer. Would I put it past them to perhaps increase these numbers to sell it to people? Yes. Not that that doesn't mean there isn't an increase, because there is. But it could be amplified messaging. But when I sit there and I wonder, is Katie Couric really that stupid? Or is she just doesn't want to say, you know, because I'm pretty sure she was probably one of the ones that was pushing the vax and everything. Like, she's saying all the right things, environmental toxin, microplastics, forever chemicals, but we all know that none of those things would cause that quick of an increase. In other words, microplastics and forever chemicals get into your system, it would take a very long time. In other words, we would have to be dumping a lot. We would literally have to be telling people to eat microplastics for 4 years in order to get it to go up that quickly. There is only one thing that possibly could have done it in that shorter period of time, and she stops just short of saying that.
Well, it's interesting because I did cut that video off for time constraints, but they go on to say, I mean, Del Bigtree actually has somebody dressed in an elephant costume walk behind him to say, there's an elephant in the room that she is not addressing. And Jackson goes on to say, hey, look, all of those things that she's talking about have been around for a number of years and haven't caused a spike.
Right.
The one thing that's caused the spike in 2021 were those vaccines. Yeah.
Look, it's going to come out. It is. I'm telling you right now, I don't know when and how, but there's simply, look at what you're just showing. This conversation is, this data is coming out at the same time you got this guy being rung up for COVID crimes and everything else, right? You see how this all
it's all coming together.
So I don't know when and how. I wish I had that answer, but I would be willing to bet my life that at a certain point in time, it's not going to be. It is going to be of the magnitude of what. Think of any other atrocity that's taken place. This is not going to stay like this forever. It is going to be common household, everyday knowledge that this was done, and it was done on purpose, and it caused massive problems. It's taken some time, but there's no way, when you just watch how these patterns, how they're just slowly seeding it out there and giving people a chance to digest it. It might not be happening at the pace people want. I understand, but look, BB, I'm a big proponent of when Q says nothing can stop what is coming.
Yes, me too.
Some people take that as like mass arrests and all these other things. Yeah, maybe. I honestly believe that when Q says nothing can stop what is coming, they knew that this operation, this dissemination was basically like pushing a little snowball off the top of the mountain. And once it gets to a certain size, it can't be stopped. Meaning, you know, with all due respect, Trump could go away tomorrow. The connections to the Q boards, they could delete the Q boards tomorrow. It's not going to matter. We're at a point now. We've been at a point for a number of years where that snowball is going, and there are just too many people out there putting out too much information too quickly to stop this.
I agree.
You are the news now, right? That's what this is about. This snowball has started, and Maybe people wanted it done in 2024, and maybe it'll be till 2027, or I don't know, but it can't be stopped.
I agree. Well, I kind of apply that to just me personally. You know, I awakened, and then I got kind of motivated to get on the battlefield, and I kind of feel like there is nothing that anyone can say or do that's going to stop me from opening my mouth and continuing to tell the truth. Nothing. Yep. You're not going to shut me up or stop me.
Yep, exactly
so
right.
There's a 2025 Korean study that got published September of 2025 in Biomarker Research, and it analyzed, get this, 8.4 million people, 8.4 million in South Korea between 2021 and 2023, and they compared COVID vaccinated against unvaccinated. So we have a clear vaccinated versus unvaccinated study. And they reported statistically higher rates for 6 specific cancers. And if you guys want to actually read that study for yourself, I have the link to it in the description below the show. You can go read the study yourself. I'm going to play a video. Before I play it, I am going to give you guys a language warning. And before I play the video, I just want to say thank you and welcome to all of the Storm Riders. You guys just raided over. Thank you so much for the Storm Team raid. Let's play this video. Language warning. Turn it down if you got littles nearby. Here we go.
It's talking about this study, and it absolutely blows my mind. There was a study that was published on September 26, 2025 in Biomarker Research. It's a peer-reviewed scientific journal with a strong reputation that analyzed 8.4 million people. It is titled, 1-Year Risks of Cancers Associated with COVID-19 Vaccination, a Large Population-Based Cohort Study in South Korea. The findings are insane. The study found a 27% overall increase in cancer risk in the vaccinated group in just the first year. How is this not the major headline story of every mainstream media outlet across the world right now? Like, why aren't we talking about this? Breast cancer, 20%, colorectal, 28%, gastric, 34%, lung, 53%, prostate, 69%, thyroid, 35%. Could you imagine that when they first came out with the shot, if people would have been told, when you take this, you will have a 27% more likelihood of developing just cancer, not including all the other diseases that it may be associated with. And this is just in the first year. Do you think people would have taken it? This is why I'm so happy that I stuck to my guns and I didn't get it. And this is why I'm so sickened that the people I love were lied to, and so angry that we who didn't want it were fucking shunned from society, and now there is zero discussion around this. And there's other studies, by the way, too. A major study done at the Henry Ford Health Institute, also a very credible institute, where the authors concluded that vaccine exposure was independently linked to a 2.5-fold higher likelihood of chronic health issues like asthma, atopic diseases, autoimmune conditions, and neurodevelopmental disorders in children. Now, what I find really interesting is the scientific research community tries to debunk only the studies that support negative associations with vaccines. And I'm not here to suggest that studies can't be flawed. Of course they can. I'm not even suggesting these ones aren't flawed. I don't know. But then why do the studies that find positive associations with vaccines not only not get questioned by the scientific community, you aren't even allowed to question them? And even though we know studies can be flawed, doesn't studies like this just at least give you pause? Like at the very least about vaccines? And shouldn't it make all the anti-vaxxers out there like me just maybe a little more respected, who are just trying to say, hey, vaccines actually aren't safe and effective all the time, and you might want to look into it more before blindly listening to your doctor who literally can't even tell you the ingredients in the vaccines or the actual risks. We have never been more chronically sicker in human history, and there's never been more pharmaceutical drugs and vaccines by a long shot. Big Pharma has never made more money than they do right now, and we've never been sicker. When are we going to wake up and put 2 and 2 together? Like, maybe we have to start asking some questions about vaccines and pharmaceutical drugs. And maybe the woo-woo people, who always look so good, by the way, are onto something. It's not that fucking hard. Share this widely and proudly, because if they ain't gonna talk about it, maybe we gotta force them to. And that's the fucking vibe today, baby.
I love it.
So that's on TikTok, right? And Instagram. And that's the kind of stuff that's getting out to a normie audience, is that kind of information.
Yeah. And look, a lot of people don't like this take when I give it, but I'm going to do what I do and give it anyway, which is the following. You don't want the mainstream media talking about this right now.
No.
I'll tell you why. because look at how angry that guy is. We all have the same anger at a certain point. Look, at this point, basically, there's no one left taking the COVID vaccine. I'm sure there's some, but we can put that to the side for a minute. So what is the key thing with the Great Awakening? It's getting people to see things for themselves and to stop listening to the mainstream media. If you have the mainstream media start telling people the truth, they're going to continue trusting them. And then all you're doing is feeding the matrix. Right. So I believe they're doing this on purpose. They're allowing everyone else to put this out there. And then every time somebody, and they freed X, they freed Instagram, they've largely freed Facebook, they freed TikTok. And so what's happening is Joe Rogan said it perfectly. It lines up with something I've been saying for a long time. He said this about 2 months ago. He basically said, look, at this point, I'm pretty sure everyone has the memo on that COVID vaccine. And nobody wants to talk about it. They're embarrassed, right? Nobody wants to admit they were wrong. Nobody wants to think about the fact that maybe they're at a higher risk of cancer or many other things. So they're just going to bury it. So that creates this perception that everyone's asleep and nobody's figured it out. I don't think that's the case. I think
I don't either.
on. And what happens is by if we're using our full control model of the media, by continuing to let Fox News and CNN run endless pharma commercials and not talk about this, then every person that stumbles across that kind of video is going to have the exact reaction that guy is. Why the F isn't anyone talking about this? And that helps break that matrix of mainstream media. So when people say, well, just have them tell everybody. No, if you have them tell everybody, they become the arbiters of truth again, and you're not breaking that mainstream lock that led to this, that led to COVID, that led to the toilet paper, that led to the vaccines, that led to the election, that led to everything else, that led to that food pyramid. You have to snap people out of that. So you want that visceral emotional reaction that that dude just had when you first stumble across, you go, holy crap, okay, this is bad, but why isn't anybody talking about this? And then maybe they do flip on Fox News and they see every other commercial is pharma, and they'll start to connect the dots like, oh, wait, that's why.
Yeah.
They're in on it.
Yeah. All right. We're going to take just a little intermission break so I can do a little ad. So we're going to throw up, of course, the Wellness Company. And let's do this little ad read. Stories on social media are drawing attention to the rise of colorectal cancer among young adults. Since 2005, colorectal cancer deaths have increased in people under 50. And just for the record, ChatGPT confirms that 65% of private oncologists' revenue comes from prescribing chemotherapy. Could recent turbo cancer in the young be just a coincidence? The good news is plenty of studies now show that traditional treatments are no longer the only choice. For example, Anthony Latai, director of the National Cancer Institute, recently acknowledged scientific interest in more rigorous preclinical studies of ivermectin's effects on cancer cells. The Wellness Company is a pioneer of medical freedom. Their medical board has stayed on the pulse of off-label cancer solution success stories and studies, removing red tape for you to easily access alternative medicines. Introducing American-made ivermectin. Safe, trusted, tested, and produced locally in Florida. Ivermectin has been prescribed globally for more than 30 years and even earned the Nobel Prize in Medicine for its proven ability to eliminate parasites. The Wellness Company is offering an 18-milligram dose for just $3.50 per tablet. You'll get a 6-month supply of 84 tablets, all at an unbeatable price. Get your U.S.-made ivermectin and own your own health. Visit twc.health/DOD and you'll save $30 off plus free shipping. So thanks to the Wellness Company. And so, Dave, you and Rambo were actually discussing recently on one of your shows Otarmany, which is Regeneron's drug that actually cures a rare genetic cause of deafness. Well, we are seeing cures creeping into the narrative, not just, the pharma symptom management. And this one is really strange. Let's take a look.
The E. americana completely eliminated tumor cells and achieved 100% rate across all treated animals. That seems almost too good to be true, doesn't it?
It does. It does. So that means every time they injected this bacteria into the tail vein, the tumors disappeared completely without fail every single time. And they actually did reintroduction experiments. So they reintroduced the cancers to the same mice whose tumors disappeared, and the tumors couldn't grow. It had immune memory. The mice had immune memory as a result as well. So, I mean, that's also very promising. So it's crazy. You know, nobody's really investigating bacterium for eliminating cancer. This GMO bacterium that have been developed, but those are dangerous. This is natural. And so, you know, we really got to hone in on this, test it in more mice, more cancer types, find the safety, find the dosing, and then eventually, you know, move on to humans. And you have to remember there's easy fails. Basically, if you inject it and something goes wrong and it starts to infect other organs, which could happen possibly, you know, an antibiotic will, you know, cut that off. And so there's an exit mechanism if something went wrong. So that's the other good point about it.
I mean, at the end of the day, this is amazingly great news, right? The fact that it's probably going to be suppressed and Big Pharma will try to keep it from you. That's another story. But do you think Big Pharma will be able to find a way to make money off this and switch from chemotherapy to this therapy if it works in humans?
First, they won't. Well, actually, they could patent a version of this bacterium if they modify it, which wouldn't be surprising. So it wouldn't surprise me if they go find this, they genetically modify it, and then further, they isolate, you know, a single compound and claim it's as good, you know. So they could do something like that, but they cannot just, you know, patent a natural gut bacterium. So, you know, we'll see if they try something. But in the meantime, you know, we need independent scientists on this. We can't let it be suppressed.
How do you? First of all, that seems like a crazy idea. Hey, let's take some bacteria from a frog's gut, see if that cures cancer. How do they come up with that idea?
Good question. Good question. They must have had an idea previously, some previous research, and just the understanding that these amphibians don't usually get cancer. So they thought, you know, maybe there's something in them, in these amphibians and the reptiles, that might be able to fight cancer. And they went to the microbiome, thinking perhaps that was a reason. And maybe it is. Maybe it is.
Well, we're finding out how important your gut microbiome is to your overall health.
Amazing, right?
Yep.
And the fact that it's natural.
Absolutely. And Bibi, you know what? Watching the stuff that's going on and how they're continually, President Trump and Maha are continually, part of what they're doing is they're breaking the belief matrix in things we were told couldn't be cured or things we were told were chronic, right? That word chronic illness has been really injected everything, chronic disease and the rate of chronic disease. And they're trying to get people to connect the dots and understand that there are things that can be cured that we've been led to believe can't. And I just can't help but go to this Q drop right here. And this is one of the most discussed ones, right? Drop 735. And Anon said, question, how long will we have to wait for the cures of cancer and other sicknesses? And Q came back and said, chatter amongst those in control has begun. They know, we know, which means the public will know. Release prior to cover up, public informed and collapse, which option? And you just heard him talking about, like, well, is Big Pharma going to be able to cover this up? So now that I read this, given that this was written 8 years ago, it actually does make sense, right? Because this is one of the questions I'm sure you get as an add-on just as much as I do. Like, you know, what the hell? Why don't they just release the cures for cancer? Well, they have. You just showed the wellness company. How are they putting out? Again, I'm not a medical professional, but how are they able to advertise things like that? Ivermectin, mebendazole, all those different things with a digital intake form that you can get from home. You know, it's amazing nobody's stopping that, right? But
exactly.
Q is saying which option? Release prior to cover up or public informed and collapse? Well, what does release prior to cover up mean? Now, I don't look, as much as we might have gone along with it. Imagine if Donald Trump had stood up in 2017 and said, I have a cure for cancer. That sounds great, but do we remember what happened during COVID when they turned hydroxychloroquine into bleach? Right? In hindsight, it would not have worked. So what they're saying is we'll release prior to cover up. In other words, well, we could release all this stuff, and at that point in history, the media, big pharma, they'll just spin it into something bad. It's Hitler, it's this and that. He's trying to kill the population.
The cover up.
Public informed and collapse. And we are living through public being
informed
and collapse. You started with the dietary stuff. People are switching away from processed foods, and they're learning about grass-fed versus grass-finished, and they're learning about the micro gut biome and all these other things. And it's collapsing that matrix, and we're creating a society where people are willing to listen to these cures. And it may not happen on the pace. Again, we all have our stories of people that don't want to listen to this stuff. I understand. But I think Q very well understood back then that when this thing started, that they could have, it is a running joke. There's a running joke that somebody like Donald Trump could announce for a cure for cancer, and there still be 30% of the people that hate him. That's a joke we all have heard.
Yeah.
But it's literal. So there was, like it or not, with the power of the media and the brainwashing and everything that was in place back when that Q drop was written, there was nothing we could have done about it. And you're living now through public informed and collapse, which is every day people are stumbling across TikTok videos like the one you played 2 videos ago and going, holy crap, and they're getting angry and they're getting motivated, and that will eventually collapse the system. But they gave you the roadmap 8 years ago, and it's just amazing. We are living through it right now.
God, it's great to be alive and awake and watching this happen.
Yep.
Last week during his budget hearings, RFK revealed that his son, reportedly his middle son, who's around 13 years old, has been debilitated by long COVID. Got a short video of him talking about it.
This is a priority for me personally. I have a son who really was debilitated by long COVID. We've had roundtable at HHS for the first time in history. We brought in the best experts from around the country, people like Jordan Vaughn from New Jersey, and the best people who have the most experience at treating it successfully from California, from all over the country. And we are targeting diagnostics to make sure that there's uniform diagnostics of very, very complex illness that manifests differently in almost every person. Treatment protocols are different than people. There is no panacea. And but there are biomarkers that can tell us what kind of treatments work best for what populations.
Thank you.
And we're working on identifying those biomarkers, matching them with a treatment, and then getting the patients together with the appropriate physician.
Okay. Thank you. So, for the U.S. National Academies of Sciences, Engineering, and Medicine actually defined long COVID as an infection-associated chronic condition that occurs after SARS-CoV-2 infection and is present for at least 3 months as a continuous, relapsing, and remitting or a progressive disease state that affects one or more organs. More than 200 symptoms are associated with this condition. According to the CDC, dated March the 9th of 2026, the most frequently mentioned symptoms include fatigue, brain fog, shortness of breath, POTS syndrome, which stands for postural orthostatic tachycardia syndrome, and that's just basically where the heart rate shoots up and the blood pressure plummets when you stand from a sitting or lying position. Additionally, headaches, sleep disturbance, joint and muscle pain, mood changes, GI issues, both constipation and diarrhea, and autoimmune disorders. And if you guys are interested, the CDC link on long COVID is in the description below the show. So according to the CDC, who can get long COVID? Well, anyone who's had a COVID infection, but more prevalent, interestingly, before the Omicron variant. We all kind of have our suspicions about what that Omicron variant actually was.
Yeah.
Or in those with multiple COVID infections. And interestingly, most people who got COVID allegedly naturally got it once and done. It's the folks who've been vaccinated that get COVID multiple times.
Yep.
So that's an interesting little viewpoint. Well, Dr. McCullough believes it's caused by the spike protein. Let's take a look.
I have seen and worked with so many people with long COVID, just where major debilitating fatigue. What are your thoughts on what's causing long COVID, and what are some of the things that you've done to help patients with long COVID?
The Biden administration and HHS spent $1 billion on this. They had the long COVID program. $1 billion, that's a massive amount of research. Yeah. Harvard got grants and all the major institutions got grants. They opened up long COVID clinics. And not a single discovery, not a single new test, not a single protocol, not a single new drug or therapeutic. Nothing for $1 billion. How could that happen? Because they didn't assess the cause of the problem.
Yeah.
So the virus is a ball. It has little spines on the surface. The spines are called the spike protein. The cause of long COVID is the spike protein is retained in the human body. That's the cause of long COVID. In not a single one of the Biden administration long COVID programs did they measure the spike protein. Did they measure it in the bloodstream? It can be easily measured by an ELISA test. Nor do they measure antibodies against the spike protein, nor do they assess tissue samples for the spike protein. Yet elsewhere in the world, it became obvious the cause of long COVID is the spike protein, period.
So spike protein, right? Hold on to that. The cause of long COVID is spike protein, according to Dr. McCullough. Well, Dave, last week we were reporting that Bayer, through its subsidiary Monsanto Bayer Crop Science, filed a lawsuit against the COVID-19 vaccine manufacturers for patent infringement. Back in the 80s, Monsanto removed specific sequences in the mRNA, and then they patented it. This recipe actually helped cells produce a lot more of the desired protein. In crop science, this recipe helps the plant develop more of the protein that kills insects. But Bayer is claiming that the vaccine companies used their recipe in their vaccines to help cells produce more of a desired protein, like maybe spike protein. So another interesting data point, the scheduled ACIP committee meeting that was supposed to be happening in March while we were at Threadfest, well, that was canceled because of an injunction in the American Academy of Pediatrics case. That case, the American Academy of Pediatrics filed a lawsuit in Massachusetts against HHS and RFK, saying that the ACIP committee wasn't following the protocol of the ACIP charter. Well, they didn't respond to that at all because the charter was up on April the 1st and RFK rewrote a charter. So the new ACIP committee that has yet to be seated will be just fine under this new charter. But on the agenda for that March ACIP committee meeting, interestingly, was the COVID-19 vaccines and long COVID. They certainly did not want that information out there. And speaking of Bayer, I'm getting ready to go on a rant, so I'm going to give you a chance to speak to that before I rant.
Have at it. Let's do it.
So yesterday, there was a People versus Poison rally outside the Supreme Court. The protesters, including MAHA advocates, argued that the EPA relies too heavily on industry data and overlooks the differences between glyphosate alone and formulations like Roundup. So this whole glyphosate controversy can be super confusing. So what I did was I set about this weekend to try to understand this for myself. I'm going to present my understanding, and I'm sure Dave is going to agree with me that we encourage each of you to then go do additional research, okay? I'm not going to present an exhaustive analysis of like all of the glyphosate research. I'm just not going to do that. what I am going to do is just try to present a more clearer understanding of the narratives that are at play currently. Okay. So why did they protest at SCOTUS? Well, yesterday, oral arguments were being heard in the case Monsanto versus Durnell. So remember, Bayer AG Agriculture acquired Monsanto back in 2018. The issue in the case, whether federal law, which is known as the Insecticide, Fungicide, and Rodenticide Act, known as FIFRA, preempts label-based failure to warn claims where the EPA has not required the warning. It's going to make sense in a second. So, the plaintiff, John Durnell, used Roundup. That's important. He used a formulation of chemicals called Roundup. Roundup includes an active ingredient called glyphosate. After years and years and years of using Roundup, he developed non-Hodgkin's lymphoma, a blood cancer. He sued Monsanto, claiming that they failed to warn users of cancer risks under Missouri state law. A St. Louis jury awarded him $1.25 million in that lawsuit in 2023. The Missouri Court of Appeals upheld that verdict. So Bayer Monsanto appealed all the way to SCOTUS, arguing that federal law, that FIFRA law, bars claims like this man brought because the EPA has consistently found no cancer risk for glyphosate. But again, Roundup is a formulation of multiple chemicals, one of which is glyphosate. That's important to understand. It's also important to understand that Bayer is facing 65,000 claims with similar arguments to this man. Bayer is arguing that the EPA approval of the Roundup label with no cancer warning preempts any state claims that are demanding additional warnings for cancer. So now let's just make this clear again. The SCOTUS case focuses on Roundup, but all of the legal and the scientific focus is on its active ingredient, glyphosate. The plaintiff used Roundup, the formulation. The failure to warn for cancer targets labeling of Roundup. But all of the EPA data is based on glyphosate alone. So the SCOTUS case is not going to resolve the merits of the argument of glyphosate versus a full Roundup formulation. It's a narrow legal question, and it's basically classic federal supremacy dispute. Does the EPA control labeling, or can state courts require different warnings? Of course, we all have more questions, right? So I went into the AIs asking a bunch of questions. Has the EPA ever conducted long-term carcinogenicity, which means does it cause cancer? Has it ever conducted long-term carcinogenicity studies specifically on the Roundup formulation? The answer is no. Mm-hmm. Only glyphosate. But independent studies have shown that Roundup formulations are actually more toxic than glyphosate alone. And RFK actually spoke about this. Let's listen.
We shouldn't be talking about glyphosate. We should be talking about Roundup. And if you read all of these documents that we've gotten from Monsanto and see all the sneaky stuff that they do, one of the most fearful things for them is that somebody is going to do testing on Roundup. Because even in their most private emails to each other, they're talking about nobody's ever tested this, and we know that the formulation is much, much more toxic than the glyphosate. because the formulation has all these surfactants in it and adjuvants in it that are intended to allow the glyphosate to slip through the bark of the plant and through the coating of the plant, and they allow also those same chemicals also enable that molecule to penetrate the blood-brain barrier and get into the human system, and they're toxic themselves. And the synergistic toxicity is something they've been able to keep the regulatory agencies from ever looking at that. The only thing they ever test is pure glyphosate. Nobody ever gets to test Roundup. And of course, Roundup has many different formulations, but they're all much more toxic than glyphosate.
So he makes a really good point. The synergistic toxicity of all of the different chemicals. So when I went digging in AI, what I was able to find was that the EPA basically tested Roundup for acute toxicity, but not chronic carcinogenicity. And they look at the individual chemicals, kind of like the vaccines for kids, right? We studied this one vaccine and we studied this other vaccine and we studied this other vaccine, but we've never looked at, well, what happens to a kid if I give them 6 vaccines in one visit?
Right.
We have no data. Same thing here. They studied each individual chemical, but the synergy of those chemicals together in a formulation like Roundup and what that toxicity is has never been studied by the EPA. So their cancer assessments, again, centered on the active ingredient glyphosate. But, and before I move on, an interesting data point about RFK. 1 year before the plaintiff in this current SCOTUS case brought his case, filed it, 1 year prior, RFK won a landmark case as an environmental attorney, representing a California groundskeeper with non-Hodgkin's lymphoma against Monsanto and Roundup. So RFK has got real skin in this game. He understands this very well. So again, back to the EPA. Very interestingly, the EPA is currently in the midst of what's called a registration review of glyphosate. So I want you guys to think about timing, right? We have the SCOTUS case talking about this, and at the same time, they're doing this registration review because under that law, that FIFRA law, the EPA must do a mandatory 15-year reevaluation. That's pretty coincidental, don't you think? This process is currently ongoing and a final review decision is targeted for this year. This review, and again, as I go through this, think about the fact that they're using AI like crazy in this administration. So this review includes additional studies addressing court concerns and open literature research. The AI is being used for systematic review of scientific literature, chemical assessments, and data extraction. So I think that this review is likely to bring a lot more transparency, but at the same time, it has to protect proprietary trade secrets, right? So RFK and Lee Zeldin, who is the EPA administrator, have been working super close together with the whole MAHA agenda. I mean, one example is just what they were just recently did with microplastics in public water. So there is the open source information available to all of us. But back to the protest and the narrative manipulation, because they're banking on the fact that we're not going to do our homework. But right. Yet all of this information is open source that I did in the course of a weekend. The protest reportedly had about 200 or so in attendance. But folks like the Glyphosate girl and Thomas Massey claim that the Trump administration is siding with big corporations like Bayer over public health.
Right. That's been a big talking point.
Oh, yeah. So the question I have is, did RFK sound in that video sound like he was going to be siding with any corporation producing Roundup? Well, let's take a look at the glyphosate girl and her highly emotional reporting.
My message is that right now Americans need to be very aware of the fact we are under attack by foreign pesticide companies. They have infiltrated our government. We are under attack from all three branches of government. We have people in Congress, we have the administration, and we have the judicial system that are basically going to bat for Bayer, who manufactures glyphosate. They are looking for protection so that Americans can no longer sue if they get sick from exposure. This is because Bayer is right now, they've lost a substantial market share. Their stock price crashed, and this is because of all of the cancer litigation around the product Roundup. So instead of just putting a cancer label on the product, which is what everyone really wants to have happen, they're instead seeking the American government to protect them from all lawsuits instead.
She just said they manufacture glyphosate.
Yeah. And, all of the, we're under attack from all three branches of our government. No, you're not. No, you're not. This government, this administration is actually doing the research that hasn't been done and hasn't been reported. And the fact that they use glyphosate and Roundup interchangeably when clearly the open source information that I've presented tonight clearly shows a difference between the two, right? And they claim that Trump's executive order that he signed on February 18th, which was promoting the national defense by ensuring an adequate supply of elemental phosphorus and glyphosate-based herbicides, is giving a company like Bayer immunity. She said it. You won't be able to sue. You won't be able to sue. Well, the EO is actually available for anyone watching to go read on whitehouse.gov. I've read it. Go read it. The EO actually invokes the Defense Production Act and makes glyphosate-based herbicides a national security priority. And that is to prioritize domestic production and supply. And why would we want to do that? Well, if 80% of our glyphosate that all of the farmers are currently using is made in China, and China cuts us off, guess what happens to our crop production? We don't have a viable alternative yet. So what they're doing is protecting the food supply in the United States, right? Until they can roll out an alternative. So
And
go
real
ahead.
quick, and at the same time, you don't think they knew what kind of narrative was going to follow from this?
Oh yeah,
Right.
absolutely.
So it's in a way, this is eerily similar to the, oh my God, Trump started a war because Israel made him do it type of thing. In other words, they knew that this was going to get conflated. They knew that this was going to get twisted, and let the people scream that he's in bed with the Roundup manufacturers and all that, because that's just going to push the truth out there more. And especially on the left, everyone's going to talk about it.
They're talking about glyphosate like crazy. They're talking about Trump in bed, Trump protecting big corporations. Oh yeah, it's like on fire.
Mm-hmm.
So in that executive order, it gives limited targeted protection against claims tied to following government mandated actions. What it does not do is give blanket product liability immunity for harm, like the 1986 Vaccine Act did for vaccines. That is not what this executive order does. It is a limited compliance shield, not a get out of jail free card. Yep. So I think there's two things for us to be watching for: the SCOTUS ruling on the labeling, and more importantly, this EPA review of glyphosate, because I don't think the timing here is coincidental. And I don't think that the very vocal MAHA advocates that are condemning is coincidental either. I think this is all part of the narrative, because, most folks only listen to that highly emotional rhetoric and focus on Trump and we're being attacked. over here, us, everybody in the chat, everybody watching, we're armed with information and we're calm and we're waiting to see what the administration is going to be revealing.
Yeah, they're like so many other things. They're missing the fact that something like this situation with Roundup has been a battle in the conspiracy health theory world for how many years, right? Going back decades.
Yeah.
And we could sit here for another hour and dissect which parts of this are PSYOP and coordinated. There's a lot of timing here that you've laid out that seems certainly very well coordinated, to your point. So I would argue it's on purpose. But the point is, what's the net result? The net result is you're bringing national attention to something that has been suppressed as a conspiracy theory for a very long time.
Oh yeah.
You know, look at that. Look at that clip you played of RFK. That was probably a number of years ago.
It
That
was.
was at some farming convention at a tent with like 150 people because that was the only place you could talk about that stuff back then. And now we have a national conversation on it. To me, that's not coincidence. That's coordination.
Yeah, I agree completely. So we're just going to have to see what happens. Just remember that RFK in that video called Monsanto sneaky.
Mm-hmm.
Yeah, we're getting ready to find out just how sneaky they are.
Yep.
Well, that brings us to a close. I'm just going to say a couple of thank yous. We've got Di Hollister with a $1 rant saying, I have much regret as a former NICU RN. This is going to happen a lot more, Dave.
Yeah.
I gave so many preemies the Hep B vaccine. I could go on and on. BB, I'm in Virginia and would love to commiserate. This is my first ever rant. Well, Di Hollister, I want to speak directly to you because, we as healthcare providers, as nurses, we were lied to, we were manipulated, and we were used to carry out some really horrible things. And the medical community has some major awakening to do. So, yes, the email to the show is in the description below. Please send me an email and we can connect. $10 from Matt Magoo, my hubby, who says The Bleeding Edge is still available on Netflix and it came out in 2018. Well worth the watch. Highly recommend The Bleeding Edge on Netflix, guys. $10 from the Mr. Leota. Thank you for all you do, BB. Thank you, Mr. Leota. LP with the $10 rant. Two of the best in the biz, BB and Dave. Thank you, LP. $10 from Ghost Smith 801. BB and Dave, I don't believe in long COVID. COVID has never been found. Am I wrong? And how so? Just saying, just asking. Well, as we presented with Dr. McCullough, right? It's the spike protein.
It's the spike protein. And I think the reality of the situation is it's very easy. Almost everybody right now, whether it's your toxicity level or metals poisoning or you're on some kind of SSRIs or any kind of pharmaceuticals, like chronic fatigue and brain fog is a huge issue amongst an overwhelming majority of the population. So if you just go out there and tell people that chronic fatigue is a side effect of long COVID, that's what they're going to attribute it to. But the reality of the situation, like you showed, is it is a real thing, and it's exacerbated by the COVID vaccine.
Oh, yeah.
So she's right in saying it. Both can be true. That COVID could have just been a manipulation, and there's some people that maybe only had it once that believe they have long COVID, and it's something else causing it. But the overwhelming majority are the people that took the vaccines.
Yeah. MB7 with the $10 rant. Such important information. Thank you both for covering these topics. You are welcome. $5 from Denise Volbach. Great show, BB and Dave. Thank you so much for all you do. Thank you. Love wins. Thank you, Denise. Mad Dad 2020 with a $5 rant. BB and Dave, much love and respect to both of you. Thank you guys so much for all of your support. And Dave and I definitely appreciate it. So what do you have coming up this week, Dave?
Well, first off, I'll implore everybody one more time to hit that positive affirmation button, whether it's the thumbs up button on Rumble or the heart on X. Share this show. I thought this was a great one. As per always, I know how much time BB puts into her research, and it shows. And I'm also going to say that BB is like 200 people away from getting to 10,000 followers on Rumble. I guarantee there are well more than 200 people watching right now that have not hit that subscribe button on Rumble. So
That's
why
that
doesn't
little
everyone
bell. That
go
little
and
bell.
hit that little button, and let's get her over, especially all the people watching on replay too. Let's get her over that 10,000 mark by tomorrow. That would be awesome to see. It's well deserved. As far as me, again, newstreason.com. That's my link tree. You can find me there. Tomorrow night at 8 p.m., I will have Mike King on in his normal time slot. I'm sure with all the insanity that's gone on the last few days,
It's going to be a great show.
he'll have quite a bit to say, as only Mike King can do. So that'll be over my channel tomorrow night at 8 p.m. Eastern. And as always, BB, thank you so much for having me on. This was a great one.
Thank you. Well, I have an unexpected day off tomorrow. Usually I work on Wednesdays, but tomorrow I'm going to be off because, well, one of the reasons is tomorrow at 2:30, Senator Ron Johnson's permanent subcommittee on investigations will be presenting Unmasked: How the Biden health officials purposely turned a blind eye toward COVID-19 vaccine safety signals. So, yeah, this is going to be an explosive one. This actually came out during RFK's budget hearings last week at the Senate Finance Committee. Johnson was presenting his draft report and the information showing that they hid myocarditis signals in young men. Yep. And then they also hid ischemic stroke signals in folks over the age of 65 that had received Pfizer boosters. And they've got emails, apparently over 11 million pages of documents and data were released from the HHS to this subcommittee. And they've been evaluating it, and they will be presenting their findings tomorrow at 2:30. So on Friday at 5 p.m., Patrick and I, on episode number 3 of Deception Distilled, Clarity in the Chaos, we will be cutting through all of the chaos and bringing you the facts on this explosive hearing, as well as all of the other health headlines that may crop up over the next week. Again, join us Friday on this channel, 5 p.m. for the new show, Deception Distilled with Patrick Gunnels. Next Tuesday, right here, 8 p.m. on Doses of Deception, Magadai will be joining us for her next installment of Herbal Adventures. And we're going to close out this evening with a brand new outro video from the very talented Macro Toolbreaker and his lyrics, and the video wizardry of the Mr. Leota. These patriots are absolutely wizards at what they do, and I can't thank you gentlemen enough for doing this for the show. So everybody have a great week. God bless you, and we'll see you on Friday, 5 p.m. for Deception Distilled. Have a great week.
Good night, everybody.
Oh, wait a minute. Now I'm having technical difficulties.